Hello and welcome. These are always fun to start here before we get to see anyone here in the webinar, but we are thrilled that you're here. This is our second quarter webinar with Dr. James Wood. We're thrilled that you're here. We're going to have Dr. Birch introduce him in just a moment. My name is Megan French. I'm the Executive Director of BirchBark Foundation. We're thrilled that you're here. This is, as always, a free webinar that we do on education for how to be the best advocate for your pet. If you are brand new to BirchBark, we have three main pillars of our program. Our pet aid assistance is financial assistance for low-income families who can't afford veterinary emergencies. We also provide free grief support to anyone anticipating or experiencing the loss of a pet if you are in California. And thirdly, our education series. We do 4 webinars a year to educate anyone and everyone who will listen or hop on our webinars on different topics about how to be the best advocate for your pet. Today we have Dr. James Wood. He's going to chat with us a little bit. Dr. Birch will introduce him. If you are interested in donating to our webinar series, you can go to birchbarkfoundation.org. As always, these are free to the public. They're going to stay free to the public. If you enjoyed this, if you'd like to support us in helping us continue to provide free education, you can make a donation on our website, birchbarkfoundation.org. I'll introduce our founder, Dr. Mary Ann Birch. Take it away.
No, thanks. Good evening, everyone. Thank you for coming. One of my big projects is, there's a book out there called Speaking for Spot. And a lot of what I think is important as pet owners is to be advocates for your pet, to understand what's the best way to be their caretakers medically. And this topic tonight is one that I'm really pleased that Dr. Wood's willing to talk about. Because we have really just discovered this. I don't know, the history is probably something he knows better, but 5 to 8 years of finding out that some dogs are susceptible to heart disease because of nutritional reasons. So I'm really excited about listening, and also that everyone who's here can learn more about how to be a good advocate for their pet in a medical way or every day. So Dr. James Wood, actually, I confirmed today, grew up locally and is a cardiologist that works at Blue Pearl of Monterey. And he went to undergraduate school at Cal Poly, went to vet school at Davis, did an internship in Colorado, and then a residency at Davis in cardiology. Those of you that may not know, specialty veterinary medicine is an extra 8 years after college for us. And we do sign up for that, but usually it's because we have a passion for what we can do for pets. So I look forward to hearing him. He gave a great lecture for us veterinarians, and I look forward to hearing what he has to say for us pet owners as well. So welcome, Dr. Wood.
Thank you so much. I'm really excited to be here to talk about this topic. I know it's one that veterinarians and pet owners alike are both very interested in, and is very important in the recent years. So I am a little bit under the weather today, so I actually pre-recorded this lecture. So I'll go ahead and share my screen and share the recording, but we'll have plenty of time at the end, and I'm happy to answer any questions anybody might have on the topic or other cardiology topics as well. So I'll go share right here. So a little outline of where. Thank you so much to Dr. Birch and everybody at the BirchBark Foundation for all the good that you do in the world, as well as for inviting me here today to talk about a pretty important topic of diet-related heart disease. It's a topic that a lot of people are interested in, and I think there's some misconception that I can hopefully clear up today. So a little outline of where we're headed through this talk. I know the details of heart disease is probably not super familiar to everybody, so we'll kind of start with the basic heart anatomy, physiology, and kind of direction of blood flow, the basics of heart disease, specifically of dilated cardiomyopathy, and then we'll spend the bulk of today talking about this entity of diet-associated DCM and the details that you need to know for your pets. So without any further ado, this is a diagram of the heart. This is kind of common to all mammals, people, dogs, cats, what have you. And you'll see we'll kind of start here with blood flow coming back from the abdomen and the legs, the head, neck, and the rest of the kind of upper half. All of that deoxygenated blood is going to come in through these two big blood vessels, the vena cava into the right atrium, down into the right ventricle, and then that gets pumped out of the pulmonary arteries to the lungs, where all of that blood is going to pick up oxygen and then come in through these 4 blood vessels noted here in this kind of cream color are the pulmonary veins. And that blood now has oxygen and comes back to the left atrium through this mitral valve into the left ventricle, which is the big, thick pumping chamber of your heart that pumps blood into your aorta to get all of that blood out to your body. So we'll kind of transition to what is another normal heart here, but this is an ultrasound of a dog heart. And I've kind of labeled a few of the relevant structures that we had just mentioned in that last diagram. And so the left atrium is sitting here. That oxygenated blood just came back from the lungs, goes through this mitral valve into the left ventricle, and then the right side of our heart is in the top of the image here. And so I'll show a couple of echo images of dilated cardiomyopathy as this presentation goes on. So the main disease that we're going to talk about today that we see associated with diet is one called dilated cardiomyopathy, and how that leads to congestive heart failure in dogs. This is a nice little diagram showing that the primary problem with dilated cardiomyopathy is that the pumping chamber of the heart, the left ventricle mainly, is reduced, and that heart can't pump effectively. As a result, less blood is getting pumped out with each heartbeat, and so the heart becomes progressively more and more dilated. The body, to kind of compensate for that poor cardiac output or kind of poor pump function, the body tries its best to maintain blood pressure, and so it does so by activating these various hormonal systems that ultimately leads to further kind of retention of blood volume, which actually hurts the heart, leads to further dilation, as we can see in this diagram. And then ultimately, when those enlarged chambers kind of can't hold that pressure anymore, fluid is going to back up into the place where it's coming from, which on the left side of the heart is the lungs. And fluid accumulation in the lungs is something we call congestive heart failure, and ultimately causes the signs that you would notice in your pet at home of coughing, though coughing has a lot of other causes, so not just heart failure. And then ultimately difficulty breathing is the main symptom that we really recognize and often brings clients in through the emergency room to see me. And so we'll see a diagram here of a dog with dilated cardiomyopathy. Kind of skip to the next image here. But you can see a normal dog on the left and a dog with DCM on the right, where the dog with DCM has a much more dilated chamber and it's not squeezing as effectively as the chamber on the left. And so ultimately, as I had mentioned, this leads to enlargement of the heart and ultimately fluid buildup in the lungs. And so what we're looking at here is a normal dog on the right, and then a dog with dilated cardiomyopathy and congestive heart failure on the left. And so you compare this, this is an X-ray image with the head on the left side of the image, the tail to the right. You can see the dog's spine on the top and sternum on the bottom. And this area here is what we call the cardiac silhouette. So it's kind of an external picture of the heart. And all of this black area is the lung tissue that should be kind of this color when it's normal and filled with air. The dog on the left, in contrast, has a, hopefully you can appreciate, dramatically enlarged heart. Takes up most of this dog's chest. So this is a dog with pretty advanced dilated cardiomyopathy. And then if I can draw your attention up here, the area of the lungs that should normally be air-filled and kind of black on this image is filled with fluid. And so this is a dog who presented through the emergency room with difficulty breathing and needed to be hospitalized in our oxygen in ICU. So once dogs develop congestive heart failure, it'll be a little bit different depending on whether this is dilated cardiomyopathy or a different heart disease such as degenerative valve disease is another common one we see. Ultimately, they present with these signs of congestion in their lungs, so coughing, difficulty breathing. And then the main medication that we use to treat them is a drug class called a diuretic that is going to make the kidneys excrete extra fluid to hopefully draw some of that fluid out of the lungs. That becomes a lifelong medication that they need to survive at that point. We also use this very popular heart medication that you may have heard of called pimobendan, or Vetmedin is the brand name, and that helps improve the heart's pumping function, which is going to help to move blood forward and again draw some of that fluid out of the lungs. We use other medications to help prevent some of that fluid retention. But generally across different disease processes, once dogs are in congestive heart failure, this is a terminal heart disease that they will succumb to. Our goal is to kind of medically manage them. I often tell clients we're kind of managing the plumbing for a mechanical disease for as long as we can. And on average, that tends to be between 1 to 1.5 years. Every dog is an individual, and the different disease processes are somewhat individual, so some unfortunately progress more rapidly, and we can't manage them this long. Others I manage beyond this 1.5 year time frame. So we're going to focus on this disease, dilated cardiomyopathy, and it comes in a couple of different forms. On the left-hand side of the image here, the vast majority of what we see is genetic disease. So people get dilated cardiomyopathy as well, just like dogs do. And I would say the most frequent cases that I see as a cardiologist are dogs that have a genetic predisposition to this disease and develop it typically later in life. So Doberman Pinschers are kind of the poster child for this disease, but we also see it in other generally large breed dogs. Great Danes are the other common one. And so dogs with primary or genetic DCM, there's no fixing their heart muscle disease. Once they go into congestive heart failure, we're managing the symptoms of heart failure for as long as we can, but it is a terminal heart disease that they will succumb to. The prognosis with DCM and heart failure from genetic disease is a little bit more on the order of 9 to 12 months on average. There are, though, some dogs who have those echo findings of a dilated heart that does not pump well, and they have a dilated cardiomyopathy, what I call phenotype. But there are some secondary causes that importantly can be reversible and confer a much better long-term prognosis if we treat the underlying disease or reason to have the disease compared to primary. And some of those are listed here, like some uncommon endocrine diseases, like hypothyroidism and Addison's disease, some infection or inflammation of the heart muscle, and then very fast or frequent arrhythmias. So again, when I have a dog who I diagnose with this disease, I look for these secondary conditions, realizing that treating those secondary conditions will lead to a much better long-term prognosis as compared to genetic disease. And obviously I've highlighted, and we'll spend today talking about these diet-related cases. This is a really nice case that was published recently of a small breed dog who do not typically get genetic or primary DCM. They looked for secondary causes in the list that I discussed below, and ultimately led them to both treating this dog's congestive heart failure and then ultimately changing the diet that this dog was on, as it was on what I will call an at-risk diet. And again, normally with dilated cardiomyopathy and heart failure, we manage them for an average of about a year before they succumb to this disease. And you can see in this dog, in day 0 and day 60, the heart is enlarged and it actually gets larger. And this dog is in congestive heart failure with some fluid buildup in the lungs. But then we have follow-up almost a few years after this, and you can hopefully appreciate the dramatic reduction in the size of the heart in this dog, which is unheard of with primary or genetic disease. So this is a dog who had, medical treatment of their heart failure, but then just a diet change, and that led to dramatic reverse remodeling or improvement of this dog's heart. And this dog lived for a long time and died of something else. And that brings up this topic that cardiologists have seen an increase over the last decade or two of cases of dilated cardiomyopathy in dogs that are not considered to be predisposed breeds, so, such as the Doberman Pinscher or Great Dane. So these tend to be atypical. I bring up a case, and I'll kind of make this talk in honor of a patient I had just last week, Jazzy Moon, a really, really sweet 3-year-old small breed dog who would not get dilated cardiomyopathy for genetic reasons. And so seeing those cases kind of raised a little bit of an alarm. These dogs receive treatment of their congestive heart failure if they're symptomatic with those medications I talked about above, along with a diet change plus or minus supplementation of these amino acids, taurine and carnitine, and I'll talk about those in a minute. And these dogs have improvement or even normalization of their echo changes. So kind of improvement to the pump function and a reduction in their heart chamber sizes. And then ultimately, in some cases, we can even stop their cardiac medications altogether down the road if they have enough improvement. And I want to emphasize that this does not happen with primary or genetic disease. And so this is really narrowing down that we are treating some secondary cause, though the exact mechanism of this disease that I'm talking about today remains not 100% clear. So I kind of want to take some time to go through the history of how this diet-related DCM developed, because the story actually starts in cats. So in 1987 at UC Davis, a cardiologist there discovered that some cases of dilated cardiomyopathy on echo were actually associated with a deficiency of taurine, which is an amino acid or a protein that's very important for heart muscle physiology, that actually cats and human are dependent on intake of that amino acid from their diet, and their body can't make it on its own. And in those cats that were deficient in taurine and had dilated cardiomyopathy, they both treated their heart failure, but also supplemented taurine. That led to a dramatic reduction in heart chamber size and kind of resolution of that specific cat's heart disease, which is again kind of indicative of a secondary condition that we're treating. After the discovery of this, cat diets across the board, the recommended daily intake of taurine levels were increased, and this disease has become exceedingly rare to see in cats these days because their diet now has an improved amount of taurine. But that's where this kind of diet-related disease was initially discovered. More recently, in the kind of early 2000s, we've discovered some cases of dilated cardiomyopathy in dogs that was similar to the situation in cats, where we measured their taurine levels and they truly did have taurine deficiency. Again, this was discovered in dogs that don't classically get this disease. You can see in a couple of these papers, those were some families of golden retrievers, as well as a smattering of other cases. And so the response amongst the community of veterinarians and pet food companies was that taurine levels have been added and supplemented to dog food diets. And so while there still are occasionally some cases where their taurine levels are actually low, and that's what's to blame for this disease, we're still seeing a lot of these cases. And if you look at the diet of those dogs, in these cases, they have taurine supplements, and we measure their blood levels and their taurine is not low. And so unfortunately, the answer to this diet-related DCM in dogs that's occurring currently is not necessarily a taurine deficiency. These cases, as we've looked more into them, initially were linked to grain-free diets, in quotations there. And while grain-free diets are certainly kind of at risk, the characteristics of those diets is actually more complex than just being grain-free or not. And that's a common misconception that I want to kind of improve our understanding of with this presentation today. And so that brings us to the question of, well, what specifically is the problem if it's not taurine levels and it's not necessarily a taurine or a grain-free diet? And so I'm going to be kind of using some data from two main studies here. And I apologize in advance, these are very kind of intricate studies of both breaking down some of these at-risk diets into their components, as well as getting blood samples from dogs and looking at their metabolites of those diets, which is basically some components that the body breaks those down into that we'll compare. And so this first study looked at just comparing some of these at-risk diets that we've seen associated with DCM in dogs and comparing them to diets that we don't typically see DCM develop with. And so in this study, they're really just looking at the diets. They broke those diets down, ran them through these really fancy machines, and I only cut off the first quarter of this diagram, and kind of continued vertically here are a bunch of compounds basically in each of these diets. And we're comparing specific ingredients in each of these diets that is a recurring theme. So a lot of these have peas and lentils in the at-risk diets compared to chicken and rice, being common ingredients of diets that are not associated with DCM. And we're trying to find specific ingredients that are either absent from these diets that could be to blame. Is it something that they lack that's causing this heart disease? Or alternatively, is there some component that's present in these diets that's interfering with normal cardiac physiology? And so some of the kind of results of this study were that some of those specific compounds were more common in diets that were associated with DCM, and peas and lentils were kind of the two signals that rose to the forefront. And there were some specific compounds of interest. importantly, taurine and carnitine were not different between these two diets. So again, as I had mentioned previously, it is not a simple taurine deficiency anymore that is causing the cases that we're seeing these days. Multiple different B vitamins were actually lower in these at-risk diets. And these B vitamins are important cofactors in the taurine and carnitine synthesis pathways, which are a couple of very important proteins or amino acids for cardiac physiology and especially cardiac kind of energy utilization. Some of those B vitamins are also heat sensitive, so this study didn't necessarily look at this, but they kind of postulated could the manufacturing of some of those diets and how they're processed alter the availability of those B vitamins. So it's not that they're deficient, it's that they're kind of destroyed in the process of making the diet. And then are there some excess plant-derived compounds that these diets utilize instead of these animal proteins that alter absorption of some of those B vitamins or other important amino acids in the diet? And then again, this carnitine level is kind of a topic of particular interest given that it's involved in cardiac energetics. The other study that was really intricate on this topic now actually took dogs with dilated cardiomyopathy, either eating the at-risk diets that we think is involved in their pathophysiology, and then some dogs eating a normal or traditional diet, and actually compared their blood work. So they took blood samples from these dogs and looked for all of those little metabolites and how they differed between the groups. They then switched the diet for those dogs eating the at-risk diets to see if some of those metabolites in their circulation changed after a diet change. And all of this is hoping to kind of identify an underlying cause of what is it specifically about these diets that makes them predisposed to this disease. They also compared dogs with primary dilated cardiomyopathy eating a very traditional diet to see if we could see a difference in their blood work profiles. And they did identify a pattern of metabolites in the at-risk diets compared to traditional diets for the dogs with DCM. They were unfortunately unable to compare the dogs eating the at-risk diets to cases of genetic DCM because the dogs with genetic DCM, as is kind of predictable, didn't survive the duration of the study. Now, dogs that had a diet change survived longer and had a significant change in that metabolite profile, shifting them towards a traditional pattern. And through this kind of intricate analysis, they identified 12 specific compounds in the at-risk diets that seemed most linked to this disease process. And 8 out of those 12 had a positive change after they switched the diet. And so they were able to kind of identify these compounds. Some of them have names, some of them have just a number because they haven't really been described before, that seem associated with this diet process. Now, I realize this is getting into the weeds a little bit. All of this is to say that we're trying to identify the underlying cause of why dogs develop this disease. But as far as what you need to know for your pets is that cardiologists are seeing cases of life-threatening dilated cardiomyopathy that both appear to be related to certain diets that they're eating, that importantly, changing the diet can lead to an improvement or even correction of their heart disease. And again, this is a fatal heart disease if not treated, and changing the diet, if that is related to why they have this disease, is obviously a kind of game changer for their long-term outcome. Now, the exact mechanism, as I've highlighted in the last 2 slides, is likely very intricate and not exactly clear yet, but there are profiles of some of these diets that are at risk, and between these 2 studies, it's clear that it's not a simple deficiency of taurine or some other amino acid. You know, a lot of these diets tend to be grain-free, but the specific actual concerning ingredients that we see associated with those concerning metabolites are diets that are heavy in these pulse ingredients. And pulses are things like peas. So whether that's peas themselves, like the whole pea, pea protein, pea fiber, pea starch, you'll see a lot of these different things listed in the diet as far as what component of the kind of bean they're using. Lentils are also another ingredient that kind of rose to the top of concerning ingredients. Chickpeas and other legume seeds. Sweet potatoes were also implicated as kind of an at-risk ingredient, though as a lower concern level related to the peas and lentils being the top 2. Soybeans, which are another legume, did not appear implicated, so those seem to be okay. This is a really important slide here, and really important to emphasize. There are many, many, many dogs eating these, what I'm going to call at-risk diets, that do not develop DCM. I do an echocardiogram on them, and their heart is completely normal. So not all dogs eating these diets are going to develop this heart disease. There is something particular about some dogs that are more sensitive to the development of this disease. Unfortunately, it's hard to predict which dogs will develop it and which won't. So while not all dogs are going to develop this disease, it's hard to know whether your specific dog eating this diet is at risk. Now, many clients of mine that are feeding a grain-free diet, the most frequent reason that I get that they're feeding it is that their pet has either skin allergies or GI allergies. They have itchy skin, they have skin infections, or they have soft stool, and all of those appear to be really well managed on these grain-free diets. And what I will say, and again, this is a little bit out of my realm of specialty outside of cardiology, but grain allergies, whether it's skin or GI, in dogs is actually exceedingly rare. More often these dogs are allergic to the protein source in their diet, whether that's chicken, pork, beef, what have you. Now, it just so happens that grain-free diets tend to use these alternative protein sources like the legume-based protein sources in their diets. And so they tend to be pretty good at managing skin allergies. But obviously it's a pretty big trade-off with pretty significant heart disease at risk. And so all of that is to say, if skin allergies or GI allergies are something that are well managed on these grain-free diets, there are other diets out there that don't have these concerning ingredients, but also don't have the protein source that your dog might be not tolerating. So there are kind of exotic protein sources like, kangaroo, alligator. There's all kinds of diets out there that have a protein source that your dog's immune system has never seen before that will still be really good at managing their disease. There are other kind of prescription hydrolyzed diets that are a good option. My own dog gets one of those because she has some soft stool that's responsive to a novel protein source. And it's also important to note that, again, I think amongst even the veterinary community, some of the early publications with this disease implicated specifically the grain-free nature of these diets. And again, many grain-free diets have legumes, chickpeas, and have the concerning ingredients. But there are some grain-inclusive diets that have grains that are also at risk and concerning. And so this disease is not as simple as grain-free or not. We're specifically looking for those legume-based diets that we want to avoid to avoid this disease. And so that's a big misconception that I'm hoping to kind of bring knowledge and understanding to. As far as what you should feed your dog specifically, my recommendations would be to consult your veterinarian. If your pet has specific allergies or they have liver disease or kidney disease, your vet can recommend a good diet that may be prescription diet, it may not be, but balances all of your pet's specific needs. If you're wanting to do some reading on your own, we generally recommend using diets that follow these WSAVA guidelines, the World Small Animal Veterinary Association guidelines, of what a complete and balanced diet includes. And then a diet that contains common protein sources. Again, the diets in these studies that were not associated with DCM tended to include things like chicken, beef, pork. And so again, if your pet has a specific allergy, that might be a different situation. But I should have bolded this one. We want diets that do not contain the ingredients listed at risk in those previous slides. So peas, pea protein, pea fiber, pea powder, etc. Lentils, chickpeas, sweet potatoes, and potatoes. And so, certainly I think diets that have those ingredients listed within the first 10 ingredients, those are the components that form most of the bulk of what your dog is going to eat. I don't want to see those ingredients in the first 10. And if they're present in the label, no more than one of them. And then consulting a board-certified veterinary nutritionist. Just as there are board-certified veterinary cardiologists that manage heart disease, there are nutritionists that can help balance your pet-specific needs. So there are some animals that have, kidney disease and liver disease and heart disease. And some of those have conflicting requirements. And so having a nutritionist who can help you come up with even a home-cooked diet that is kind of well balanced in managing your pet specific needs while still being palatable is a really big thing. So I definitely recommend that. So that was the main topic of this talk. I do want to spend a brief moment talking about kind of other nutrition for cardiac disease. I would say that dogs with advanced heart disease, the main thing that so whether this is a dog with dilated cardiomyopathy, mitral valve disease, cats with hypertrophic cardiomyopathy, if your pet has really advanced heart disease, the main thing that I'm going to talk about and recommend, aside from this diet-related DCM topic, is salt restriction. And so I would refer you actually to a really nice resource. The Tufts Veterinary School has a really nice nutrition page. And so within this nutrition page, there's a little link here to managing your pet's sodium. There's a lot of other topics here, including the nutritional DCM topic, that I encourage you to read through. But within that tab, there's an example and basically a link to a page for low sodium diets for dogs and cats that I put here on the next slide. And so it's got a really long list of diets, and these are all over-the-counter diets. These aren't necessarily prescription diets. Some of them are. And they've got nutritional information as far as their calories, and then their sodium levels. And so this is kind of decreasing levels. Some of these ones are a little bit high sodium for a dog in heart failure, but then some of these down here are much more salt restricted. And so if your pet wants to try a couple of these and see what's palatable and what they enjoy, I generally recommend some salt restriction, again with the aims of reducing how much the body is retaining fluid and kind of overloading an already dilated heart. And so my rules of thumb are to generally, if we're going to get quantitative about it, aim for less than 50 milligrams of sodium per 100 calories. And I do that per 100 calories because we see patients all the way from, Chihuahuas up to Great Danes. So obviously targeting a certain number for sodium has to be kind of normalized for how much they're eating per day. So if you kind of measure out what you're feeding your dog in a day, whether you're measuring by cups or by weight, see how many calories based on the bag you're actually feeding them per day, and then you'll have a number to look for that you want to kind of have as a ceiling in their total daily sodium. Practically, if you're not going to be out there doing math on your dog's pet food bag, I would say just avoid really salty, jerky treats. If you can kind of just avoid what you think is going to be salty, like those jerky treats or lunch meats, I think that's a good idea with advanced heart disease. And then feeding a low salt diet, if you want to refer to that provided handout, I think that's a great resource. I would say dog food diets that are marketed towards senior pets tend to be pretty well salt restricted. So if you're walking down the pet food aisle, anything that's marketed towards a senior that again meets those WASAVA guidelines and does not have chickpeas, lentils, and peas in the first 10 ingredients, those would be things that I think are totally fine, and you don't necessarily need to go out and get a prescription diet. So I'll have some time here reserved at the end. We'll go back to a live video here. I'm happy to answer any questions you might have about the diet-related DCM topic, as well as any diet-related heart disease questions, or any heart disease questions for that matter. And again, thank you so much to the folks at BirchBark. As a specialist here at Blue Pearl, I see cases literally every day that BirchBark helps provide care for people who are in a tough time, and provide care for pets who can't otherwise get it. So they do a lot of really, really good work in the world. And any way you can help out this organization, it really does go far to touch a lot of people and a lot of pets in the community. Thank you so much. All right.
Great. Thank you. That was very, very informative.
I really enjoyed it. Yeah, thank you. I'm so glad you were able to do that pre-recording since you weren't quite feeling well. What a wonderful solution and full of really great information.
And we do have a couple questions if you're ready.
Yeah, absolutely.
You may actually see some of the ones that are in the webinar chat. The first is, are there reliable genetic tests for DCM? And if so, is there any value in testing dogs that are considered to be genetically predisposed?
Yeah, that's a great question. There are two or three genetic mutations described in dogs. Typically, those are mutations that are present in purebred dogs. So within the Doberman breed, there are two described mutations, and testing is available actually. If you have a Doberman in your family, the North Carolina State University Vet School, if you kind of navigate their website, their cardiac genetics page actually has a testing kit that they'll mail to you for, I mean, it's really cheap. It's like $40 or something. They'll send you a little swab kit that you can swab your dog, send it back to them, and they'll do genetic testing to see if they're a carrier for one or both of the mutations described. Unfortunately, our understanding of the genetic causes of DCM in dogs is still a little bit behind the human experience. So there's hundreds of mutations in the proteins involved in heart muscle physiology in people that have been described. And we have two or three, and again, only in purebred dogs. So if you don't have one of those breeds, unfortunately, we don't necessarily know the genetic cause of every case. But we do know fairly well which families of dogs it runs in, even if we don't have the specific mutation described. So again, there are kind of those predisposed breeds that we know of. We've got a couple mutations described. The situation is basically the same in cats with hypertrophic cardiomyopathy. We have a few mutations described, but certainly there's probably more out there that we don't fully understand yet.
Right. And that leads into the next follow-up question. Are breeds that are at higher risk for primary DCM more susceptible to the nutritional form?
That is a great question. That is actually a really challenging one to answer in practice. Because I will, for example, have cases of, a Doberman or a Great Dane who comes in, and on the echo they have DCM, and they are feeding one of these diets. And then the question becomes, do you have primary genetic DCM or is this nutritional? And honestly, in those cases, I counsel my clients that, we can do genetic testing if it's a breed that we know has a mutation, and maybe that helps us understand more. But unfortunately, we won't really know. And so I think with the prospect that if it is nutritionally mediated, their prognosis is so much better, it's often still worth a diet change. I still do. I didn't really mention this in the lecture. I still sometimes supplement taurine and carnitine levels. Again, most of the cases these days aren't really deficient in those things, but it's one of those can't hurt, might help situations to give them the supplement. So I still try and supplement them, hoping that it's going to improve their long-term prognosis. But oftentimes those genetically predisposed dogs just have genetic disease. So I wouldn't say that dogs predisposed to genetic DCM are more sensitive. There are some dogs, though, that have been shown to be more sensitive to the taurine deficiency specifically. And again, you saw in that those couple of papers I shared, golden retrievers tend to be one that are more sensitive. And then Cocker Spaniels are the others that are a little bit prone. But again, that's specifically for taurine deficiency, which again, we're seeing a little bit less of these days.
Great, thank you. The next question, is there research on whether cats have a similar reaction to the legumes, or is there a dietary suspicion in cats yet?
I would say not that we've observed. As I had mentioned in that lecture, seeing genetic DCM in cats is really, really rare these days, because they were similar to the Goldens and Cocker Spaniels. They were truly a taurine deficiency. And now that all of the diets across the board have just added taurine, we just don't see it that much anymore. I can't say that I've seen as many cat diets out there on the market that are kind of similarly based in the pulse-based products like the peas and legumes. So maybe I'm just seeing less of those, but either way, I'm just not seeing that many cases of DCM in cats across the board.
Yeah, there's a few of those limited ingredient diets that use potato or pea in cats. So it'll be interesting.
Maybe they're less sensitive. I haven't seen many of those cats come through, but it's hard to say with certainty.
Yeah, good point. So the next question was, somebody says, I hope to get a senior dog someday, and understood that dogs, unlike cats, can be vegan. Does that play a role in this nutritional concern?
I might defer to you, Dr. Birch, a little bit on the vegan aspect with respect to other aspects of their health. I would say similar to, a diet being grain-free on my end anyway, it's not necessarily that a vegan diet itself is bad. It's just that to make a vegan diet, to get the protein source, they're often utilizing these ingredients. And so to me, it's not that the diet is grain-free or that it is vegan. It's that to be that diet, they end up utilizing a lot of these ingredients. And again, with full transparency, we don't know exactly like what is it about the peas or the lentils that's a problem. There's very complex and studies that put you to sleep reading through them about the metabolomics. Like, do we know the exact mechanism? No, but it seems linked to these ingredients. And so for that reason, diets that are vegan are probably going to utilize a lot of those concerning ingredients.
Yeah, and I appreciate that the first 10 ingredients or more than one, because I've definitely seen, the first six ingredients, including the peas and lentils historically. And
Yeah, I mentioned on that slide, I think certainly looking in the first 10 ingredients, because that's going to be what makes up the majority of the diet. So ideally not having any of those ingredients in the top 10. Some of them are like way down there at the bottom of the bag. And I think I wrote in the slide, as long as no more than one of those ingredients is in the top or in the label altogether, that's ideal.
yeah. Yeah, and I did notice that slide also said soy has not been implicated,
Yeah,
which,
yeah,
again, how much soy is a dog going to really love eating? And
yeah.
that's a good question. All right, I think there's one more. If a dog's primary diet does not include the main components associated with dietary DCM, does feeding treats that include the ingredients increase their risk?
That's a great question that I guess I don't have a definitive answer to, other than as long as it's not I would say, and I'm making this number up somewhat arbitrarily, no more than like 10% of their caloric intake for the day, I think that's probably fine.
I think I'd make up the same answer. Yeah.
Great.
So,
Great minds.
and then last question, which maybe pretty complex, but what's the relationship between DCM and ARVC?
That is a wonderful question. ARVC stands for arrhythmogenic right ventricular cardiomyopathy. That's a disease that we see most often in boxer dogs, and that is one of the diseases for which we have actually two now genetic mutations that are also available for testing through NC State if you're so interested. Um, it's also a cardiomyopathy, so it's a disease of the heart muscle. With DCM, the main issue is the pump function is reduced. With ARVC, that disease is more primarily an arrhythmic disease, so an electrical heart disease that puts dogs at risk of passing away suddenly with ventricular arrhythmias. There's a couple different forms of the disease, though. One of them is primarily arrhythmic, and on their echo, their heart is structurally very normal. There is kind of a more severe manifestation of that disease, ARVC, where they have arrhythmias, but they also have a dilated cardiomyopathy phenotype on echo. So on their echo, their left ventricle and right ventricle are very dilated, have poor pump function. They can go into heart failure. So it can look very similar. And in that sense, it is very related to DCM. So a disease that we kind of separate categorically in our medical minds. But I think on a cellular basis, and actually in people, some of the same mutations can create both diseases. So it's something that is probably more related on a kind of cellular level than we fully understand.
Yeah, it sounds like a Venn diagram kind of.
Yeah.
Yeah. Yeah. Well, that is all the questions. If anyone else in the audience has questions they want to put in the chat or the Q&A, we have a minute or two more. Looks like everyone's questioned out. That was really informative for me. I feel like I got a nice level of information, a nice new layer of information about the disease and the research. So thank you.
Thank you so much for having me.
Thank you so
Thanks
much,
for being here.
Dr. Yeah, thank you, Dr. Birch. As always, I'm so thrilled to host these through BirchBark for the community. Before we pop off, I'll just take this opportunity to plug what we've got coming up here for BirchBark. We were thrilled to have a table last weekend at Music for the Animals, a little event through the Santa Cruz Cider Company that was really fun. If you came out and joined us, thank you so much. We have a couple of really fun things coming up this summer. This Saturday is our first Legacy Circle lunch. So if you're interested in being a part of that or coming to join us this Saturday, please be in touch. We are going to do a event with Carmel Music in the Plaza this summer. It's going to be July 24th. We're really thrilled to be a part of that. There's going to be a great band. It's Friday night. Come down, join us. Proceeds come to BirchBark to do more of this for you. We're going to be at Scotts Valley Art and Wine August 16th. And again, our signature event this year, Fall in Love, is going to be October 24th. So thanks for sticking around. Thank you again so much to Dr. Wood. Again, always great to see you, Dr. Birch. And please look out for our Q3 webinar coming up soon.
Yeah. Thanks again, Dr. Wood. I really appreciate it.
Of course, anytime.
Feel better.
Thanks.